Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing another really fascinating guest for you involved in creating a better tomorrow. Today on the show, we have the honor of being joined by Taylor Justice. He is the co-founder and president of a company called Unite Us. This is a really interesting tech company. They have a mission to improve the health and well-being of individuals and communities by integrating all of the social determinants of health. And their goal is ultimately to unlock the potential of communities. They strategically partner with government agencies, health systems, insurers, even community organizations with their technology, their network, and team of experts. And ultimately, are looking to, in essence, make a seamless system to do things like send and secure referrals, track persons' total health journey, and ultimately analyze outcomes on a wide range of services in this really centralized, cohesive, and collaborative ecosystem that they talk about. Taylor is a social entrepreneur, previously founded another cool company called HigherEchelon, a government consulting firm, very passionate about solving these significant problems in health and human service sectors, has an MBA from Columbia, undergraduate, bachelor's at West Point, and he currently leads their team of innovators at Unite Us, ultimately to create these accountable coordinated care networks, both in the clinical and non-clinical domain. A lot of really interesting topics that we don't normally get into on the show. Very honored to have him with us. Taylor Justice, welcome, and thank you so much for taking time to come on the show.
No, appreciate it. Thank you so much.
Great having you. Very interested in starting off by handing things to you for a little bit to talk more about you, both from the civilian sector as well as your military background, because clearly you were bitten by the entrepreneurial bug quite early. At the same time, we've profiled many wonderful guests that been through West Point, United States Naval Academy, and so forth. And again, thank you for your service. Love to hear a little bit of that side of your story too, and a little bit of how your service to our country also sort of coalesced into what you're doing now.
No, I appreciate that. So I grew up in a very, very small town in northern Kentucky. Lived there till I was about 13. Moved to Florida where I got introduced to the game of football. Played through middle school, through high school. Was fortunate enough to be recruited to play football at the United States Military Academy. So spent 4 years playing football there. Was commissioned as an infantry officer in the Army, and unfortunately was medically discharged a couple years after service, which really spurred the idea for what we're doing now with Unite Us. And what I saw, and my co-founder is also a veteran, currently still in the Air Force Reserves. But my story was going through that medical discharge, dealing with the VA, finding a new job, finding a place to live, just saw some of the inefficiencies from that transition from active service into the quote unquote civilian sector. But at that moment in time, you're just kind of in survival mode. It's like, I got to figure out what I'm going to do. Because coming out of West Point, you have a 5-year active duty commitment, 3 years in reserve. And I was medically discharged just after my 2-year mark. So I thought for at least 8 years, I'm going to be in the military. That's going to be my path. And so when your world gets kind of flipped upside down, you're just kind of like trying to figure out, let me get stable. Let me figure out what the civilian sector is, but just always saw this inefficient process. And I was fortunate enough, I could fall back on the West Point network and didn't necessarily struggle. But when I got involved with a veteran nonprofit organization as a volunteer in Philadelphia, I really saw folks that were having issues connecting to the civilian community in a number of different ways. Some were like the high flyers. Hey, I'm going to go use my GI Bill to leverage a master's degree. And
Mhm.
others that were being evicted from their home or were in the justice system or didn't have access to food, some of those individuals that were in crisis, and they were trying to connect to services in their community. And I just had this Excel sheet trying to connect folks to services, and it became an administrative nightmare because one, it wasn't my full-time job. I was a volunteer with this nonprofit. The nonprofit, it wasn't their discipline either. They were focused on physical fitness and social activities, basically creating an environment where veterans could connect with civilians in a new city that had an affinity for the veteran military community, but just kind of
Mhm.
like, this is my new community. These are the folks that live here and kind of welcoming them in. And then the biggest frustration was the time it took. If I had somebody that was needing food, was needing housing, was needing different VA services, the follow up and the repetition, because all of those different
Mhm.
organizations didn't know about each other. They didn't know that they were serving the same veteran or the same family.
Mhm.
So Unite Us was born out of how do we make that process more efficient. And so we built a
Mhm.
software platform that really initially focused on the veteran serving organization, these nonprofits that provided different services. And there was a white paper done by the Joint Chiefs of Staff called the Sea of Goodwill. It wasn't a lack of resources. There were 45,000 veteran nonprofit organizations that provided services. It was navigating which organization am I eligible for? What type of services do they provide? Are they in my community or are they a national organization? So we built a platform that was like the best last mile, not just a resource directory where, hey, here's an organization that can provide food or housing or employment opportunities,
Right.
because those organizations might not know that they were part of that list. They don't know that that
Right.
individual showing up at their door. It just creates multiple avenues where people could fall through the cracks. So with Unite Us, the goal was could we give software to all of these organizations, either integrating with systems that they have today, or if they're just using pen and paper and wall full of brochures as their referral mechanism, could we be their technology stack? So that if Taylor walks in and he is in need of food, but also in need of housing and also in need of navigating the VA, I could seamlessly connect him to those different organizations that provide those different services all in one place. So now, as a service provider, I can help Taylor and coordinate care with two other entities that previously I might have had to negotiate or engage with them through email, through fax machines, through phone calls. That is just very time consuming and doesn't help Taylor immediately.
Right.
So we started to build these networks across the country specific to veteran and military. And then in 2018, the term social determinants of health, or now people call it social influencers of health or social drivers of health, it changes weekly or monthly depending on what people are calling it
Right.
at the moment. But Dan and I had no idea what it meant because the community never called it social determinants of health or social drivers of health. They just called it their work. And so what they explained to us was 80% of someone's overall health and well-being happens outside of the clinical environment and
Yeah.
in the community. Do you have a roof over your head, food in your belly, money to pay for your home, utilities, basic needs? And if you have any deficiencies or any lack of access or lack of services or issues within those basic need categories, it was going to impact your health in some way, shape, or form. And so when you peel back the onion there, you start to realize that most folks don't know that these services are available to them in the community. So then they leverage the hospital system.
Right.
People will go into the emergency room because they don't have food or they don't have a place to sleep. You see people that sometimes will take an ambulance ride from one side of town to the other because they don't have transportation, or maybe that community doesn't have public transportation. And so you see a lot of avoidable spend just because people don't necessarily know exactly where to go. And so they'll show up
Right.
in a clinical environment when a social service is more appropriate. So we expanded our platform to be service provider population agnostic, no longer only focused on veteran and military. We could help anybody that needed to access these needs. So think of Medicaid population, Medicare. We do reentry programs, children and family services, maternal health, mental behavioral, opioid programming for folks that are dealing with substance use issues. If you need to connect to these services, we have infrastructure that can help you. And
Hmm.
so the platform itself is now expanded across the country. We operate in all states. We have statewide networks in a vast majority of them. And then we've also created, or excuse me, acquired a couple companies that give us some additional capabilities. One was an analytics organization that could really help organizations with decision making of like, okay, this person walks in my door. I might want to ask them about food or about transportation or about housing, and I provide none of those services. But if I can address some of those things, it might help with whatever service category I provide. And so the issue that they were having previously, they didn't have any like what or how do I go address that issue with the
Hmm.
marriage of our organizations. You can have the analytics, you can address that issue, and then on the back end, you can say, did this work or not? And then we also have a tool that allows us to help reimburse community-based organizations for their services as well. So the technology stack has grown over the years and really an end-to-end solution for social care. So that was a long-winded way of answering your question in the background, but it's been fun and it's been
Yeah.
interesting to see the market mature.
Yeah, no, it's really interesting, and again, I appreciate the way you laid that out because we have also, I don't know how many episodes, but we've talked about social determinants of health, and I think again, people are familiar with what that is, but
Yeah.
not as much. But this other principle that you were just bringing up, which is basically social care,
Yeah.
this extremely broad term that encompasses everything you were just talking about. So, well beyond the clinical care, and then also everything from children to older adults to those with disabilities, can everything from home care to daycare centers, counseling, transportation. So, really, you're integrating everything, which is awesome. And again, this principle of social care, I think, is an important term, let's
Yeah.
just say, in thinking about the social determinants we spoke about before. One thing that you talk about, and I'm not a tech guy, but I'd love if you could take us through for a couple of minutes. What is, I mean, a closed loop referral platform, and sort of walk us through what that just generally is, because I know that's in essence, when we, as you were just explaining, when Unitas sort of started a decade or so ago, the core program initially was, this veterans centric approach, and you built the
Yeah.
first of many closed loop referral platforms. Walk us through what that entails in
Yeah.
terms of the tech audience, or the folks that are interested in tech that might not be as tech savvy, but
Yeah.
love to hear just a little bit of how that works, what it
Yeah,
means.
let me start with like what it's solving for. So
Sure.
when we came into this space, human and social services has usually been considered one of two things. It's charity, where we're just trying to help folks, and that's nonprofit organizations that provide services, or it's government assistance, and it also has a stigma where it's like, oh, people feeding off of the system. There hasn't been a ton of innovation in that space. So
Mm-hmm.
what you see is a lot of organizations don't have sophisticated technology. And so when they're making a referral, that is literally a wall full of brochures. If you've ever walked into your primary care doc and you see that on the side and there's brochures there, hand that off to the person, send them on their way, and they hope they figure it out. I hope you get the services that you're looking for. Or it's a sticky note, and I have this old list of resources that literally community health workers or social workers will have binders of resources. Let me write this down and go talk to this person. It's a very manual process. And so you would send that person out, not really knowing if they receive that service or not. So Unitas's whole goal is we make it easy to deliver social care. And so what you have to do is you have to go that last mile. So all of those services that you see brochures in that primary care office, We will go to every single one of them. We'll map the services that they provide, the programs within those services, the eligibility requirements of those programs, down to the humans that run it. So when I make a referral to a housing organization, it's not just housing.org. It is Bob or Mary or Sue at that organization that I'm sending a referral to that's going to accept that referral. And I can see within my dashboard, my system of record, if she accepted it or not. And if she did, ultimately, when that service is provided, I get the information back in my system without having to pick up the phone, without having to ping Mary, without having to do any extra effort. You're creating a system where all of these different nodes that were previously not connected are now connected through a care coordination network. So as I send out a referral, I get time-stamped along the way. Did the person show up? Were you able to accept it? Did they receive the service or not? And the beauty of the system on a closed loop is it tells you good or bad. Was the service actually provided? If so, what was it?
Mhm.
Because you can't just say, hey, yep, got the service. Well, what does that mean? If it's housing, as the example before, was that permanent shelter? Was that emergency shelter? Was that
Mhm.
temporary shelter where I have some sort of follow-up that I need to address? And on the other side of that, if it wasn't provided, also why? So that we can now start to track the gaps in services. Maybe this person wasn't eligible and we need to update the eligibility requirements because there's a new grant that just came through or a grant was cut and those services are no longer available. So
Right.
the system needs to be adaptable to whatever changing conditions are happening in the market. Closed loop means that you have real-time information from the source, the community-based organization, the government entity, the healthcare entity on
Mhm.
what services they provide and if they're still available and if they're still accepting folks to come in so that you don't send someone to a resource that isn't open, that doesn't have capacity, or doesn't offer that service anymore. And so the technology component is we've spent a decade going last mile across the entire country and building a closed loop referral network. So now when organizations sign on to our service, they are joining a network where there's someone on the other end. They're not joining a network that's just a resource directory where I
Sure.
don't know if those organizations are even participating within the network or not.
Got it. Got it. Perfect. Perfect. And again, appreciate you laying that groundwork out. Um, so let's I thought it'd be interesting to talk because obviously you cover many segments, as I mentioned in the intro, in terms of government, in terms of providers, payers, community organizations. And I thought it'd be fun just to take a walk through some of these examples, because each one is more interesting than the next and gives you a lot to think about. I thought an interesting place to start would be sort of on the government front and some of what you were doing to support reentry and so-called justice-involved populations. And you lay out some very interesting facts here. We have literally close to 100 million Americans that have some type of criminal record. A large chunk of that are expected to sort of, hey, all right, you're back in society now and find services, as you were just saying. That's not probably the most efficient way to get things done. And these folks need everything from, and there's a very nice example that you work with the Sacramento County Department of Public Health. It might be a food bank, legal services. It may be that someone went into prison and came out. They weren't a senior citizen when they went in. They came out and requiring eldercare services. So a lot going on here, and there's a very interesting flyer you have. We'll put a link to this about sort of the flow. Recently incarcerated gentleman named Adam dealing with a screener within your closed loop system named Janice. Take us a little bit into this part of the story and
Yeah.
walk us through some of this flow. I think it's really cool and a really excellent example of what you put together here in this context.
Yeah, we do a lot of this work across the country. And the ultimate goal with these programs is addressing recidivism,
Yeah.
making sure that people aren't going back into the justice system and that they're connecting and can live a life that doesn't put them back into incarceration. And so the process of connecting these folks to services is very similar to the veteran process, right? Of transitioning from active duty military into the quote unquote civilian sector. The
Yep.
difference with reentry programs is that there are certain restrictions. Depending on the level of their crime, i.e., if someone is a felon, they might not be eligible for any government programming. So they have to rely solely on the nonprofit community or other resources outside of those public benefits. And so the need to have a coordinated system that breaks down that old fragmented network of organizations that provided these types of services is strictly important. So in the example that we gave over where, that individual connects with a resource coordinator, could be Janice, could be their parole officer. And they need access to what are some employment opportunities? Is that a programming that we would take them through with goodwill? If they weren't convicted of a felon and it was a felony and it was a lower type of crime, are they eligible for SNAP benefits?
Mm,
So food stamps. Are they eligible for Medicaid? If they are a senior citizen and above 65, are they eligible for Medicare? What just a quick assessment of what services is this individual eligible for, and then creating that perfect curated list of resources that we're not only going to make referrals to, we're going to see did they receive those services, and ultimately were those services provided positive or negative, so that we can continue to help this person live a life of self-sufficiency, but also make sure that they don't fall into the cracks. Whereas previously, if I had somebody that was going on SNAP benefits and then I took them through a employment program and they receive a job that pays them $1 more than the eligibility requirement for SNAP, now they're going to have to make a life choice.
mm,
Do I go take that job, or do I stay on SNAP because I need to feed my family? And I don't see a path forward. With our system, we're able to identify those benefits cliffs, and you can pull in that local food bank that might need to jump in and facilitate food for 2 to 6 weeks until this person has enough funds to kind of take over payment of that themselves. Whereas if not, that person's going to stay on food stamps because they're in survival mode.
mm,
And they're going to stay in government assistance in perpetuity because they don't see a way of stepping out without having to take a big risk up front. And that's where you want to have this coordinated system where folks aren't taking making these long-term life decisions because they're trying to address a short-term speed bump or issue that they're running into.
mm,
And so the coordinated network allows you, again, to quickly identify if there is a potential speed bump, i.e., services ineligible, the organization can't provide the service. Maybe they've tried a couple different times to go receive a service, and I need to redirect to a different organization where they feel like the network is working for them rather than they
mm,
have to go work a network. And if they have to go work a network that they don't understand, they
yeah.
might go back to old behaviors. And again, you just see this continual cycle. So you see a lot of states, local governments that are really looking at reentry programs and understanding that I need to have a very sophisticated, coordinated network to connect to these public, private, nonprofit organizations to provide these services so that people, again, don't go back into the justice system.
Got it. Got it. Very elegant process. Um, the Another really interesting case example in your materials, Taylor, is um, the way you think about sort of home health care. And again, this is a really nice example in the sense that, as you mentioned before, clinical service is just a small part of this overall social care puzzle. And, most of us will only see our doctor, 1 or 2 times a year. We see our pharmacist every couple of weeks. We may see a nurse in the Walmart Wellness Center
Yeah.
multiple times a month, and more. Even though many people might not be aware how prevalent it is, healthcare in the home. We've talked everything from aging in place to hospice care to sort of visiting nurse care and so forth. I'd love to hear a little bit about the strategy here because again, this really opens up healthcare everywhere
Yeah.
beyond even any type of clinical setting, and love to hear some of your experiences and stories related to the home healthcare angle here.
Yeah, I mean, I think home health care is a very viable solution depending on the market. So when you're in rural communities, it's very difficult just to have it make sense for some of these organizations to provide that care because you might have to drive a couple hundred miles to get to someone's home. But where you have home health services, where an individual is going into a home, you want to make it easy for that home health nurse or um, um, uh, social worker, whoever's going into that home, to be able to address needs as they see them and relatively quickly. So if I'm dealing with an older population, just going in and doing a physical or getting vitals or making sure that they have their medications and things of that nature, those are critically important. But if I see that I'm the only person that comes and visits this individual um, ever, I might be running into isolation issues. Where can we have local organizations that can help address that? We see that also in the veteran community, where 1 in 4 veterans, we're working on a program right now with the VA, where 1 in 4 veterans feel social isolation. And so that then tends into you see veteran suicide numbers or outside of the veteran community, suicide numbers as well. That is a community response where now that home health organization has an opportunity to address that need. It's not their core service offering. It's not, a part of their delivery mechanism. But when they have their tablet and they're engaging with that organization, if they have access to this network, they can start to pull those resources in and just making sure that we're looking at this individual holistically, so that it's not just med adherence, or are they going to their medical appointments? Do they have food to eat? Is there a utilities or a housing issue if this person could potentially be evicted? Is it just having someone that come in and check on them outside of just the clinical environment? Those social needs could be a local faith-based organization that can come in and have a conversation with them. And what you're doing is you're wrapping around this individual, their holistic needs. Everything from basic needs to just having a conversation with another human, because the only time they talk to someone is when that home health nurse comes into their home. That can be problematic if you're trying to help someone become healthier. So again, it's just creating access at the point of care where you can address multiple needs quickly. And it's not, hey, I'm going to give this person a flyer and hope they figure it out. Well, they're already part of home care.
Yep.
The likelihood of them leaving that home and going out and doing some of those engagements on their own is pretty small. So we need to be proactive in that engagement so people will come to them.
Awesome. And while we're on a related topic, one of the many great testimonials the organization has, there's one on the website from Tatiana Bajorquez, I'm pronouncing that correctly, from this organization, Helping Hand Senior Foundation, and aging, healthy aging, and sort of everything that comes with it has been kind of a hot topic for us the last couple of years. Again, it means many things, and clearly these community organizations like Helping Hands, again, to have to juggle many needs for, as you're saying, my my mother-in-law, who's in her 80s, doesn't, always have access or understand even what's available for her. We
Yeah.
recently did a show with the folks from Lyft and their healthcare business, which is all about, hey, there's, I don't know how many millions of doctor visits and pharmacy visits that are just missed because,
That's right.
person A can't get to point B. And it's literally hundreds of billions of dollars to the healthcare system that gets messed up. Talk a little bit about aging, a little bit about senior care, and some of, you can use this example if you want or other examples, but I think it's, again, a really nice example of, this holistic approach you're taking.
Yeah, I mean, I think there's a ton of services available. I think one thing that you see on the Medicare side of the house that you're starting to see an uptick on the Medicaid side is Medicare always had some optionality for supplemental benefits. So it could be food, could be transportation, could be maybe some housing assistance requests. And so what it allows us to do on the aging population, again, is to provide those wraparound services. Again, usually they're not as mobile as someone that's younger. Leveraging technology to find resources could be a burden. So you want to create, no matter who they're engaging with or what door they walk through or who they talk to has access to a broader set of services that, again, are not just clinical.
Hmm.
And when you put that technology into the hands of folks that are engaging with them, they just have more ability to address some of those needs in real time and connect to those services. So, similar to other populations, it's again quick access to care. But then, can we leverage some of those advancements, if you will, in the Medicare space for Medicaid? And so, what we see on the Medicaid side of the house is the ability to reimburse for some of these basic needs. And so states like North Carolina that rolled out what they call their healthy opportunities pilots have shown significant, and it's the first study that showed a significant reduction in healthcare spend while also showing an increase in health. Because they were able, through their 1115 waiver, to reimburse community-based organizations for food, for transportation, for housing, and other services. And you have third-party studies through UNC. JAMA just put their report
Sure.
out. And then you have actuarial data coming from Mercer that show the savings are real, which in Medicaid, not a lot of people thought that that was possible because you'd see
Hmm.
other 1115 waivers that just kind of put buckets of money out there, give them to health plans, and expect the health plans to distribute that. And what you see in certain states is sometimes those health plans just hold on to it because it's revenue, and they don't distribute that. But within North Carolina, there were certain accountability metrics, a specific fee schedule to address this population, and it worked tremendously. And so now they are continuing to expand that program, which is a perfect point in time because if you start to see what's happening at the administration level,
Yeah.
they're looking for cuts across the board. And there were cuts requested in the Medicaid arena for up to $880 billion. I think they've since cut that down to $660 million. But what you see within North Carolina is you can do that in an effective and responsible way that addresses three key measures. One, you don't have to reduce standards in care. You
Hmm.
make people healthier and you reduce spend. What better use case is there? And all you have to do is allow states to open up their aperture of what they can spend resources on. It's not adding additional dollars because these basic need organizations, basic need services, food, transportation, housing, are much less than the clinical interventions. And so if you start to layer those into service delivery where you're blending healthcare and social care, you have the ability to bring spend down. And North Carolina is a perfect example of that. So we have been communicating that message for the past 3 or 4 years. Now we have the actuarial data to approve it. And I think it's a great model that can be leveraged where you transform delivery in our country to not just be healthcare delivery. It is health delivery that is bringing in social care to make sure that we are thinking about the holistic needs of individuals and families, where you can marry again good health outcomes
Hmm.
with appropriate spend.
Right. Right. Yeah, it's yeah, clearly we're in the era of efficiency of spending money
Yeah.
properly. And Unitas has built a rather impressive sort of toolkit of predictive analytics to basically unlock all this data. You gave the Medicaid example. Talk a little bit about sort of the platform here, and then are there any, we always talking about sort of the Lyft example and sort of the money being saved just when we can get somebody to their appointment. We did
Mhm.
this other really interesting story just about a year ago with AARP and sort of the interesting connection just became having good batteries in the hearing aids and how sort of the
Yeah.
dementia outcomes. Any interesting stuff pop up that you can talk about that's not confidential about, wow, if we just did this, we'd save $500
Yeah.
billion or anything that you can talk
Let's go
about.
back to let's go back to the Medicaid example that I had in North Carolina. The
All right.
actual data that came out in Mercer showed that over a 10-year span, if you implemented this type of programming and optionality for states to include these services in as
Mm-hmm.
part of a Medicaid reimbursement model,
Yeah.
over a 10-year span, you'd say $44 billion.
Nice.
Pretty significant.
Yeah.
And again, hits those three metrics. You don't have to reduce standards of care, improves health, reduce costs. Just by adding that language in where you can have the option to include these services as part of your delivery mechanism. And so for us, what we had to build in North Carolina specifically is you don't want to replicate revenue cycle management in the healthcare sense for community-based organizations. Everybody in healthcare will tell you that it's generally a headache. And so what we had built was we have that referral platform, no different than when an organization would receive a referral previously. They'd take that person through a process and close it out. Now what they can do that we built into the technology is they turn that outcome, that service that was provided, into an X12 file back to a health plan or an invoice to be reimbursed for that service. It happens on the back end. Again, going back to we make it easy to deliver social care by connecting systems. So we don't need people to leave their system of record. We'll do the integration. Then, when you have those nodes connected, you improve decision making. What's the next best action I should be taking for this individual that I'm providing care for? And then ultimately simplify payments, especially for community-based organizations to engage into the economic model of healthcare and some of these government services. Again, with a whole focus on being efficient, accountable, and transparent on the services that we're providing. So from a data perspective, we're the only solution in the market that has shown an ROI because we've gone through the paces of working with government, working with healthcare, and bringing in these third-party validators that the service not only works, it can transform how we deliver care and save dollars. And so $44 billion cut to Medicaid will make a dent in that $660 billion ask to reduce Medicaid budget. But you give states, again, even though you're looking for cuts, open up services, the amount of services that they can provide, give them flexibility to pay for some of those different services, and then ensure that people aren't staying in cycles of government assistance in perpetuity. That isn't just a public benefit offering to the individual in need. That is a benefit for that state, and even from a revenue perspective. If you have folks that are now becoming self-sufficient in contributing, that increases revenue for states to provide additional services and things of that nature. There is a flywheel effect to making slight adjustments in how we deliver care that, again, isn't 100% solely focused on clinical, which is critically important. Don't get me wrong. But going back to how we started this, 80% of someone's overall health and well-being happens outside of the clinical environment. So
Yep.
if we give them food in their bellies, a roof over their head, and the ability to pay for those basic needs and services, you can help people become self-sufficient.
Yep. Yep. Impressive. Very impressive.
Thank you.
Taylor, what should we be on the lookout for as we get further into 2025 in terms of your broader social care transformation? I was reading, sort of the 2024 summary where, I think 60 million connections now facilitated, 152 some odd million dollars of reimbursement funds, 500 new customers. That was all 2024. What's coming up for 2025, and then any other public facing stuff that's going to be happening that you can tell us while we have you today, please.
Yeah.
Yeah.
So this market has continued to mature. Even just 5 years ago, I think some of the stats that you just rattled off, I'd be like, that's going to be tough to hit. But with the growth and maturity and the recognition that social care infused with healthcare is critically important and reduces costs. We hit nine figures last year in reimbursement. I think that we
Nice.
will be in the 10 to 11 figures very quickly. Because North Carolina was the first state and they were only given $550 million to allocate. Now, when you look across the country, there are billions of dollars now being allocated to states where they can include these social services. I see that trend continuing, even with the focus on efficiency and cuts and whatnot. For all the examples that I just gave previously, I think you will continue to see advancements in technology. We fought for a decade to make closed loop referrals a thing, period. When we first walked into the space, everyone's like, it'll never work. It takes too long. Community-based organizations won't participate. They have too much on their plate. And so we just did the work for 10 years, and now it's a standard. You go into every state, a closed loop referral system is a mandated technology stack that everybody's putting RFPs out for. And so we helped make that market. Now it's the evolution of that. It's not just closed loop. That is par for course. If you
Mhm.
can't do that, then you're not going to be able to do some of the next things. Now it's like very targeted interventions, going that last mile, specific to populations. You're seeing a lot more AI come into the space on removing some of the old way of how you create resource directories. We deployed a tool that you have a lot of organizations out there that were spending human capital just keeping resources up to date. That was an old way of doing things. If you can have a solution that provides that resource directory that becomes a source of truth for everybody, it's not a guarded piece of information that people think is like their intellectual property. We believe that should be a public benefit for everyone, and you shouldn't have to pay for that. And so providing that out into the market where, again, people are then not having to spend dollars keeping things up to date, they can provide it to direct services. That's where the market continues to shift towards of how do we advance, how do we continue to push dollars to provide these services, and how can we show the overarching impact. So you'll see an increase in spend on reimbursing for these services for community-based organizations. Again, moving from nine figures to 10 or 11 just this year alone. And then you'll continue to see advancements where AI will start to take some of the old manual processes of, like I
Yep.
mentioned, keeping resource directory information up to date and some other
Sure.
things, where you can focus human effort on some of these more white glove type of services where I really need to make sure I'm taking folks through a process where they're not falling through the cracks. That could be reentry programs, maternal health programs, veterans programs, et cetera, et cetera.
Very cool. It's gonna be a busy 2025, but no, it's I love hearing stories about companies like yours that as you were saying, it starts just a couple guys talking, but really blossoms into something that impacts all aspects of the care system. So it's extremely impressive. Taylor, well, happy today. I just want to ask you one other thing. I think it was released recently, a documentary with Dennis Quaid on the Healthy Opportunities
Yeah.
North Carolina pilot program. This got me, you could say, mention about that, but this got me thinking because one of the things, as I was reading about you in one of your bios, it mentions something about how that you have. Oh, here it is. An abnormal obsession with documentaries. And I was reading that. I was like, man, I have a very abnormal obsession with documentaries. My wife's always like, why do you watch so many damn documentaries? But um, what documentaries are you watching? Anything cool that you want to mention along those lines? Because I watch way too many
Yeah.
documentaries nowadays. But
I would also like to hear what your favorite documentaries are because I need some new ones. I'm kind of stuck in these like docu-series
oh
documentaries
yeah,
right and in
me
completely
too.
unrelated to the topic that we're talking about right now. I got incredibly obsessed with playing golf during the pandemic. And so there's a docu-series called Full Swing that kind of follows some PGA tours. Each episode is a different PGA tour that they follow through that I've gotten pretty obsessed with watching old series, and they just released one not too long ago in February of their latest season. But back in the day, I used to watch like Freakonomics was super interesting
I,
to me. Following that. I'm forgetting the name of it right now, but it was around the housing crisis.
sure.
And like what was a CDO. And I just love when documentaries do one, they give you the knowledge of what's happening. Then they always have like these cool animations that break things down in such a very simple way where you can take some complex topic and break it down where you can understand how financial institutions were kind of lumping these different housing loans together from like AAA all the way down to the different service categories and how most of them were just becoming bad assets. So at some point you were going to see this crash and just how it continues to build. I'm
Yeah,
forgetting the name of that one, but it was an older one, and Matt Damon I think was the narrator of it.
right.
Um, and then you have like the Pat Tillman documentary. There's just I don't know. There's a ton of them that anytime I see them, and similar to your wife, my wife's like, oh gosh, we got to watch one of these again. I'm just like I'm obsessed with them. I love it.
Yeah, she's it's like the conversation piece. Whenever we go out with people nowadays, she was rolling her eyes like, oh man, you're gonna lose us friends talking about this stuff. I go into the fear of all the conspiracy stuff just because I find it fun what people
Yeah,
find
yeah, yeah.
conspiratorial, but it's still, yeah. And then I get a lot of people rolling eyes at me, but whatever. No,
There is another really good one that I just watched. It's like How America Was Made. And it
okay,
talks about all the different entrepreneurs that started,
yeah,
JP Morgan and
more right.
Standard Oil and all of that stuff.
They're fun.
Yeah,
They're
they're
fun.
fun.
Yeah. Well, yeah, really, again, very impressive stuff, Taylor. I love the entrepreneurial journey. I wish you and your team the best with this as you continue to grow and, continue to connect communities, connect services, and as you say, deliver on this principle of whole person care. So just really very impressive. Again, for everybody that is going to be listening to this episode of our show across the various podcast networks or watching on the YouTube channel, again, you've been spending time with Taylor Justice, founder and president of Unite Us, doing really amazing work to deliver whole person care, to integrate various services to address the social determinants of health. Taylor, I want to thank you for taking the time out of your schedule to come on today to talk for a little while about everything you've been up to. Thank you for everything you do. And as we like to say on our show, thanks for helping to create a better tomorrow for millions of people out there via what you're doing. Really an awesome story. And thanks for sharing it with us.
Well, thank you so much. Very grateful for you letting us tell our story and kind of communicate the work that we're doing. We're very proud of it, and so again, very grateful for being able to participate today.
Awesome having you.